Nisa Mbula, and welcome to Hope Channel Fiji. Thank you for joining us today, especially in our series, Oral Health and Overall Health. We welcome you. And of course, we welcome our guest, Dr. Numaya. We are glad that he can join us once more today, and we look forward to what he will share with us in our Oral Health and Overall Health episode today. And in particular, we are going to be looking at the dysfunctions of the temporomandibular joint, which is the TMJ. And yes, would you like to start us off by saying a little about TMJ and how we should be careful in taking care of it, but then we have these disorders and how we can alleviate them. Would you like to start us off with just reminding us about the TMJ, where it is and its functions?
It's a very wonderful makeup, temporomandibular joint, and just in front of your face, nearing your ears, and it moves everything, as we have been saying. And it's very important that we understand how this TMJ works and its structure. And as we have come to the acronym MBULA, believing, understanding a life of the TMJ in action.
Okay.
Yeah. And, TMJ, it moves everything from breathing, thinking, moving, drinking, eating, resting, reproducing.
It's all the functions of the
It's all the functions.
humanity.
And as one writer writes, oral health is the essence of humanity.
True.
And for oral health, as we have our episodes of oral health and overall health, yes, and we should keep or maintain this wonderful essence, in good health and in its proper management.
Okay.
Yeah, and as you have said, today we are going to look at the dysfunctions. Yeah,
Dysfunctions.
and from you can just say, okay, from right breathing to something wrong with our breathing.
Yeah, true.
And then that means that there's a dysfunction in the TMJ.
The TMJ is not working properly.
Yes. And from the right thinking, and then dysfunction in thinking process, then something wrong with the TMJ.
It all goes back to the TMJ.
It goes back there. Okay. And with the right movement, moving, and to dysfunction in the movement of the whole body from head to toe.
Okay.
Yeah. And we can see drinking, and then it's something really directly related to the mouth. And if something wrong with the dysfunctional of the TMJ, then it affects your drinking. Yeah.
All the different functions of the body.
Yeah.
Once the TMJ is in trouble, there's problem with all the other functions as well.
It's very important, and you can see it. The finer details, Yeah,
just going back to God's word. Doc,
yes.
We've been looking at the life of Moses. Okay, so there was some dysfunctions.
Okay, it reminds me again that Moses, the man who wrote the first 5 books of the Bible.
Yeah.
Amazing, I think we just on the right man to talk about
use as
Moses.
an example,
Yes.
And there in Exodus 4:10, he says, I'm reading from the New King James Version.
Yes.
Then Moses said when he was asked by God to go and facilitate the release of the children of Israel from Egypt. And he said, then Moses said to the Lord, "Oh, my Lord, I am not eloquent." See, I'm not able to speak clearly. Neither before nor since you have spoken to your servant, but I am slow of speech and slow of tongue. So this is the problem of the TMJ.
Yes.
He's saying he has an issue. There's a problem here. And then what did the Lord? The Lord said to him, "Who has made man's mouth? Or who makes the mute, the deaf, the seeing, or the blind? Have not I, the Lord?" So, you know what? I'm just trying to refocus this to say, any dysfunctions. And the Lord is asking you and me, not to give excuses, because He asks who has made the mouth. That was what He told Moses that day. But anyway, let's have a look at the dysfunctions. We need to be aware of this because it's critical.
Very critical.
All the functions of the body, if they don't operate properly, then there's an issue with the TMJ. And we need to look at this, the issue, the dysfunction, the cause, and how to take good care of it. Maybe we need to make a start on this common TMJ disorders. Would you like to start us off with that, Doc?
Okay, and from there I can just talk about Moses. He knows there's a limitation,
Yes.
But God
Intervened there.
And he knows everything,
Yeah. He still gave excuses, Moses. And so God said, okay, I'll bring your brother.
Yes.
But, he's going to speak for you, but I'll give you the message and you give it to him. So God is always there. When He calls you, He has a purpose for your life.
Okay, when we know we have limitations, and then we know that God can do everything, anything. Okay, temporomandibular joint, it connects the jawbone, the lower jaw, mandible to the skull. And it allows for movements necessary for chewing, speaking, and yawning. And you see that Moses is complaining about his ability to speak. And God is asking him that big question: who made man's mouth? So we, in front of us, are some of the models, plastic models. They are no life.
No.
But God made our mouth and is full of life, full of vibes and energy.
And this one too is not, see, the top is moving, but
but for us it's not.
It's the lower one.
It's only the lower ones because of this wonderful joint, which we call the temporomandibular joint, and it's got our very much below there. Again, temporomandibular joint. Can you just show this one? Connects the jawbone, mandible to the skull and allows for movements necessary for chewing, speaking, and yawning. Okay. Dysfunction of this joint is referred to as temporomandibular joint disorder. So something out of order. And can cause pain. Something out of order, because God created us wonderfully and fearfully made, and then everything in order. But when something's out of order, then the result is always pain.
Yes, I've actually experienced that, Doc. I was sharing when I went to see when I was in Papua New Guinea. It is quite painful because when this joint here disconnects, you can't even close your mouth. And you're struggling to try and put it back in place. Some of us, I used to enjoy corn and peanuts, but those were the types of food items that caused my
aggravates
it. So I'm always careful. So, even, a lot of us, we buy beans at the bean cart, and while sitting in the bus, we're chewing away. So just exhausting our mandibular joint.
It needs rest.
Yeah, it needs rest. That's why when we have 3 meals a day, and don't eat between meals. Give this a rest.
Again. We talk, we eat, and then we...
we strain the different parts of the body, the stomach, the jaw. And then dysfunction of this joint refers to as a temporomandibular joint disorder, can cause pain, discomfort, and restricted jaw movement. And then we just talk, we eat, we never think about how this wonderful... masterpiece of creation maneuvers everything, articulates everything. And then we coming to the common TMJ dysfunctions and their causes. One is muscle disorders. We see our joint or our face, our body is covered by muscles. The flesh, and you see everything goes in order. But the pain and discomfort in the muscles surrounding the TMJ. The cause, excessive jaw clenching and teeth grinding. Again, this teeth grinding and jaw clenching. Bruxism. Bite your teeth in touching each other, and then this strain on your muscles. When you're angry, when you're angry, that's what happens.
Yeah, and
you clench your teeth.
And everything.
Not
and
realizing.
then it brings negative manifestations. Jaw clenching, teeth grinding, bruxism, poor posture, or stress. And then that brings about the muscle disorders. Yeah, and then the internal derangement of the joint. You see, we see the muscles outside, but the inside the joint, the internal
the inside part,
mechanism of the joint, the dysfunction, displacement of the articular disc. These are some of the parts inside the joint, of the joint, inside the joint, leading to clicking. Sometimes you feel click, or popping, or jaw locking. Lockjaw.
Lockjaw.
Yeah, and the cause is trauma to the jaw, arthritis, of the bone, or excessive jaw movements causing disc misalignment. Everything that because we should be
everything's in order.
In order. Let the order be the order, or let the normal be the normal. Something that's
So it's not well aligned. That is when your jaw gets locked.
Right.
And you are not able to eat.
It's due to excessive jaw movements. We really open our mouth wide, then we talk.
Talk loud,
Talk loud.
Especially when you're fighting or arguing.
And those things, they bring strain to the muscles and to the nerves and to the whole being of our body now, in particular our TMJ. And then,
number 3.
And then number 3, degenerative joint disorders. These are some of the diseases. Osteoarthritis, the rheumatoid arthritis. Because in our joint there is a bone, and then there's fluids for the joints and ligaments, and all these things, they work together. The absence of example, the joint fluids, then the joints don't lubricate well or won't function well. You see, we are fearfully and wonderfully made, as King David said.
We find that sometimes you go to doctors and they suggest to take out some of the fluids from the body.
Like acupuncture type of...
but here, I remember for me, they removed some from my knee because there was swelling. And then I've never been able to replace that. So arthritis sets in and the pain onto the joints. So that's not a good thing to do because you need that to lubricate the joints.
Lubricating joints, the synovial fluids in the joints. That's the wonder of how God is. No wonder He told Moses, I am the one who make your mouth, and everything about you is in His mighty hands. Okay, and then the dysfunctions, breakdown of joint cartilage. And you see our joints, they have cartilages, they've got connective tissues, and they've got these fluids and muscles. They all work together. When there's the dysfunction, when there's a breakdown of joint cartilage leading to pain, inflammation, and restricted movement. Joints should be, the joint works should be
free to move.
Free to move and it functions well. And then, but if something wrong, then it inflamed.
They start complaining.
And restricted,
knee pain,
and restricted movement. Okay. And then some of the causes can be aging. As we grow older, our body starts to
deteriorate.
Change. Okay. And autoimmune diseases or previous injury. And injury. I'm thinking about this. The boxers. They always aim for this part when they do the boxing. Because
the head.
And injury can happen. Sometimes can lead to some of.
But sometimes it will lead to
movements of the body. Okay. And then number 4, the dislocation of the jaw. Jaw dislocation and the subluxation. And the dysfunction is the jaw moves out of place. Yeah. It's so wonderful how we have been created. And this TMJ is a very wonderful masterpiece of creation. It's very special. It's got a unique, And the jaw moves out of place and becomes stuck in an open. And sometimes some people can't close their mouth.
Can't close. Just okay.
And then it's very discomforting and painful, and sometimes we can just talk like this freely, or we eat or we drink, and then when dysfunction occurs, then we realize, oh, I've been just using something without even understanding how well they've been functioning in normal times. Okay.
Yeah, so, we need to have, make sure that we are able to control these dysfunctions.
True.
And, so how can we go about, taking control of these dysfunctions?
Yeah, taking control of your health, or taking control of your TMJ, Yeah.
How to manage them.
Yeah. And, managing pain and inflammation, okay. It said here in this, I just apply cold or warm compress to the joint for relief. Yeah. And sometimes this water therapy, it create wonders. To our sometimes we just need some of this very simple apply cold or warm compress to the joint just for relief purpose.
Remember, I mentioned that I had this huge problem when I was back there.
Right.
And so they just provided for, they did the therapy for me there with a doctor. Just 2 basins, one with real hot water,
right,
and one with cold water. Cold ice.
Alternate.
And then we put that.
You start off with what? Cold water, or start off with cold water?
Start with that one, and then just but which is the warm, I think, is 1 minute. The hot is 1 minute, and the other one is over. I don't recall now, but there's one of them that you have to apply it longer.
Oh, long. I think warm.
Yeah, I think it's the hot one. It's the cold one. You put the one quickly, and then you put it out, and then the
warm.
Yeah, cold one.
Oh, okay.
And then
you
continue.
Then you end it off with warm or cold?
End with warm. Yeah, I think we end with hot.
Oh.
But let's check that out. I'll check
it's
it out.
It's very important. When applying cold or warm compress to the jaw for relief, and then that's for managing pain and inflammation.
Yes.
And then for reducing stress and muscle tension, we need to practice relaxation. Yeah, and like deep breathing.
Yeah.
And meditation. Yeah. Deep breathing is it's a good form of relaxation.
Yeah, that breathing exercise that I mentioned.
Yes.
You breathe in and count to 20.
And even I was thinking about this deep breathing, or just normal breathing. When we breathe, even our mouth, even our stomach moves.
Yeah.
When you breathe in, the stomach sort of...
when the lungs expand, everything just expands also.
It's amazing. No wonder it's this TM joint which moves everything. Okay. Yeah, this to reducing stress and muscle tension, we need to be knowing some of relaxation techniques like deep breathing or meditation, and avoid clenching of the jaws. As we see, like this is normal. We always have a rest space between teeth, the top teeth and the lower teeth. And then when the teeth touch each other,
the tongue falls.
And when the teeth touch each other, then that's very tension. It's really hard for the muscles, hard for the TMJ, hard for the mind.
Yeah, true.
It's bring stress. So no one is here. You must avoid clenching the jaws. Keeping the teeth slightly apart when it rests. See, there's always a space. Teeth don't touch.
Don't touch.
Yeah. when teeth touch, then there's stress. Does that create some?
Yeah, I think it all deals with our feelings. Eh?
Yes.
When we are angry, that is when those
we are
things
angry,
happen.
no wonder we said the kacha number timu, kachbati, then. But it's a very tension.
We just need to be happy.
We just need to be happy.
Relax,
And if you are worried or what, then that's. If you're worried, Jesus said, "Bring to me all your worry and all your care." And sometimes when you have your limitations, then that's the time it will increase your reliance on God.
Yeah, God comes in, just like what he did with Moses. Moses had, Moses was quite genuine here. He actually expressed the issue that he was facing. But God stepped in and said, God said, I'll be with your mouth. Who created your mouth?
And they've got a good message to tell to the people. He's not going to tell them, you're going to be here forever.
No,
he's going to tell them the good things. And then correcting jaw movement and posture. We need to maintain good posture to prevent muscle strain. And then, as you have demonstrated, we need to be performing some jaw exercises. And under the guidance of professionals. Physical therapists. Those are people who manage our physical body. And then dietary adjustments.
We need to be careful with our diet.
Yes.
The food that we take in.
Eat soft foods. When you have problem, so don't continue chewing very hard foods because it will aggravate the problem. So eat soft foods and avoid chewing gum.
A lot of people love that chewing gum.
Avoid chewing gum or hard foods.
One type of chewing gum they call the jawbreaker. You know those huge ones. So it does break the jaw. But why would people love to chew chewing gum? Just chew and make all that noise and
and then
very musical about it. But then avoid chewing gum if you want to save your TMJ.
Because when we chew, remember chewing gum, we chew it for 1 hour, 2 hours,
And you're giving false signs to the stomach for digestion. And
and then you're just training your TMJs, training your muscles.
In the gallbladder, the gallbladder? Once they know that the jaw is moving. Like with chewing gum, it releases the bile. Releases the bile and then it goes. That's why we have stomach ulcer, because it's releasing the bile. And the bile is quite
and there's no food there to...
No food to digest.
You see, so it's very important of how this TMJ functions and everything sort of just connects. And then here, when you have TMJ dysfunctions, then eat soft foods, avoid chewing gum or hard foods. And one thing too, your size of the food bites. Make sure it's bite size. Don't eat food in big chunks.
Some people love to stuff the food and then trying to chew it off, and the mouth is too small to accommodate all that food.
It's very hard for it's hard for the brain, hard for the TMJ, and it's hard for the muscles, and even hard for the mouth and the teeth too. So it said here, cut food into small pieces to reduce jaw strain.
Even eating meat, fleshy foods. It's meant for the dogs and for the animals because they have the proper teeth to tear the
canines.
Canines, For us,
it's more of plant-based. Dental and medical interventions. We need to be using a night guard or splint to prevent mouth guard. Mouth guards, to prevent teeth grinding.
So you put a mouth guard like on the rugby
because when the teeth touch each other, then there's always a strain. So we always need a space.
So if you are grinding a lot, the suggestion is to use a mouth guard.
Yes. Use a night guard, or splint. If necessary, consult dentists or specialists for corrective treatments. These are some of the things that we go through, and some people are really having a hard time enjoying daily lives because of this TMJ dysfunctions. We're coming to that.
Now we tell you how to take care of the TMJ, and to avoid those dysfunctions that you had just given.
There's always a saying, prevention is better than
cure.
Prevention is always better than cure. And we must practice proper jaw alignment. Yeah? Always maintain that very sensitive balance, or not the alignment. Yeah, yeah, it's meant for that. So practice proper jaw alignment. Keep your tongue on the roof of. This is one how to
make sure that alignment is in place.
You keep your tongue on the roof of your mouth. This tongue that falls out. Yeah, see the tongue is on the lower jaw, Yeah, and the roof of your mouth is the upper palate. And then it said here, keep your tongue on the roof of your mouth. And then
so this one will have to be here, try and
since it's down here, then you just sort of keep your tongue on the roof of your mouth, and the teeth slightly apart when at rest. Yeah, as we have been saying, then your teeth, when at rest, it should be slightly apart. Don't touch the teeth. Don't touch. It should be a space, and teeth slightly apart when at rest, and limit excessive jaw movements. Avoid wide yawning and chewing hard foods. Yeah, so limit excessive jaw movements. Wide yawning and chewing of hard foods, they really have very
give stress to the jaws and the TMJ.
Because everything has got its own sphere, the upper and the lower, and then sometimes we try and reach the very maximum. But we should avoid it, Yeah.
And it's interesting they're avoiding biting your nails.
Yes. Nails are very tough.
It's quite tough. And there are people
biting the nails, and some like biting on the pen, and we should avoid those
habits. What do you call them? There's a term that we use for that. Where you
habits like nail biting, That's how we manage stress effectively. Reduce stress through exercise, relaxation techniques, and avoiding habits like nail biting. Avoid unnecessary strain. Sometimes we put on the strain on our body. We should avoid this unnecessary strain, and refrain from resting your chin on your hand. Can you just demonstrating?
Yes.
Avoid it. Avoid resting your chin on your hand or holding up. See, when it looks grumpy too when we...
when you're angry. So you avoid that.
Yep. Or holding a phone between your shoulder and ear.
So when the phone rings,
then
you answer, hello. Yeah, no, I'm busy with...
then you put on the shoulder and ear.
Okay, I'll do it like this. And then you're doing your housework while the phone is here.
It really brings strain to your ear. Avoid unnecessary strain. Refrain from resting your chin on your hand or holding a phone between your shoulder and ear. Regular dental checkups ensure proper biting alignment. As we said, you got proper biting alignment, and address any dental issues early.
Yeah, that is why it's important to go for a dental visit on a regular basis.
Yes. And one thing too, with all the teeth present in the mouth, 20 for children, 32 for adults, then they create a proper alignment. And if one tooth missing, or it causes misalignment, and then it brings strain on your mouth, on your teeth, on your mouth, and on your whole face. If it brings strain, the loss of a tooth brings strain on your TMJ.
True.
Because the tooth is a very unique tooth.
Yes. Everything is unique. Thank you,
Can you just read the last...
thank you, Doc, for taking us through those dysfunctions and how to take care of our TMJ. And remember, by following these preventative management strategies, you can help maintain a healthy TMJ and avoid painful dysfunctions. So, we need to visit the doctor when we have issues like this.
Wellness visit.
Wellness visit. Not when you are already experiencing the dysfunction, then you go. But to prevent the dysfunction, take good care of your TMJ and your jaw.
Who made the mouth?
Yeah, God made the mouth.
Amen.
And he asks the question, he asked that question to Moses, And who made your mouth? Remember, God made your mouth. Make good use of it. Thank you so much for joining us. Thank you, Doc, for taking us through those dysfunctions and how to take care of them. We'll see you in our next episode.
Thank you.